Turn toward me just a bit. She's got one more right here. It's just hard to see. Okay. And most of the time patients have a little bit more on one side than the other. I'm going to try to get as many of these as I can. She looks like she may have a little bit more on this side, so try not to do too much. If you feel this one, I'll inject you again. Find that some patients, just like patients who are going to the dentist, sometimes they're a little bit less sensitive to the lidocaine blocks and have to have more. Again, I'm trying to stay just mid-dermal, maybe a little bit higher. Okay. Right now, the other way to treat these, if they're a little bit higher, very often we will actually make a horizontal line just above the vermilion border of the lip to smooth these out. But what I think I'd rather do for her is put just a little line of Restylane along the vermilion border itself to see if that will even some of this out, since I've given her this other treatment. Is that okay with you? Can I give that a shot? All right, so I'm just going to turn her slightly, and we're just going to barely put very quick injection here. She has one little sensitive area there. And just a couple more drops on this side. Make sure you get in the right plane on the lips. If you're too superficial, you're going to get bumps. You can see the needle, but I'm not in the lip itself. Okay, and this side was nice because it didn't bleed as much. All right, I have just delivered approximately 0.3 cc's of Restylane to the vermilion border of Shantae's upper lip. We're trying to reduce some of the perioral rhytids that she's been developing. She also had some Botox in this area. It's already starting to swell a bit, but I think we're going to get a really excellent response. I also delivered some Restylane in the mid to upper dermal layer of the dermis in the vertical rhytids, just a few of the deeper ones on her upper lip. So I really feel that she's going to get an excellent response because they're not that severe at this time. So this should really help to prevent them from getting more severe. That with the treatment of the Botox that I gave her prior to starting this session. She has a little bit of swelling around her mouth now. As time goes by, if she doesn't ice it, it would swell, but we're going to ask her to ice it for a little bit longer. And within the next 24 to 48 hours, the swelling should reduce and she should see the effects of this injection. Shantae was concerned about the development of some perioral and periorbital rhytids. She noted that over time she had some lines developing over her upper lip that were of concern to her. I decided to give her a combination treatment of Botox and Restylane in order to get the most effective correction. She was treated with the Botox in the perioral area. I deposited 4 units of Botox to her upper vermilion border and 2 units to the lower vermilion border in order to balance it out. And then I proceeded with the treatments with the dermal filler. I treated her vermilion border on the upper lip and the upper dermis. This was to iron out the defect a little bit more smoothly. I thought you would get a better effect if it were in the upper rather than the mid-dermal area. This combination was designed in order to give a more effective correction to the perioral rhytids. We saw her a few days ago. She had an excellent result. When she pursed her lips, you could barely see any line formation whatsoever. So I feel that the combination treatment was the correct treatment for her, and she's very pleased that the rhytids are almost eliminated. Now we're going to concentrate a little bit on the lip. I'm going to be giving Jelena a dental block. Usually the fillers in the lip burn quite a bit, and this is one of the most sensitive areas that we inject. So I'm going to be giving her a dental block, and this is 1% xylocaine with epinephrine, 2 cc's. There are some people that suggest a little trick because sometimes the canine tooth is not actually where the nerve is anymore, but the nerve runs in a line that would be parallel to the mid-pupillary line, so that would be about here. So I'm just going to put a little marker on her face so I know exactly where I want to go in the event that hers has moved around. Here is the mid-pupillary line, and just about there, where her canine is, I'm going to be going in the mucosa, another half a cc. Okay, how's that? Is that a little better? Okay. Then we're going to do the lower area, same position, canine. Some people are more or less sensitive to the xylocaine, so sometimes we have to give a little bit higher block. Okay, and here. It's burning. We also often give a little bit of xylocaine in the lip commissures because these blocks actually don't penetrate out quite so far. I'm just going to go out here. Is it starting to feel numb on that right side? What about this?
Can't feel it.
Okay. Sometimes we get a little bleeding with the lip because it's very vascular. So I'm going to ask her to dab a little bit if she starts to feel anything there. She may not since she's so numb. I'm going to be using yet another filler for this. This is Juvederm. This is a hyaluronic acid as well. This is a little bit denser than the regular Hyalform, and it is suitable for nasolabial folds and the vermilion border of the lip. I am also going to be injecting a small amount into the body of the lip. We want to start, I'm going to tilt you just a little bit again, all the way over here, the corner, and just underneath the vermilion border. And what I'm going to do is a little bit of the push-along technique here. You can actually see it as it's going through.